Hello, and welcome to Healthy Living. I'm Dr. Donald Pelto, and today I have Dr. Bret Scher here, and he is a cardiologist. He's also the medical director for the DietDoctor. Bret, thank you for joining.
Oh, thanks, Don. It's my pleasure. Thanks for having me here today.
You're welcome. So I want to talk to you a little bit about your interest in health, being a cardiologist, and kind of how your practice has changed, especially with the DietDoctor over the last few months.
Yeah, it's very interesting to think of where I started and how I got to where I am today as the medical director at DietDoctor.com. It wasn't necessarily a straight path, but when I started in cardiology in my fellowship, I started in a preventive fellowship. So I knew I wanted to focus on prevention rather than, the stents and all the invasive part. That stuff is amazing, what people can accomplish and what people can do, but I wanted to prevent it from the beginning. So after I finished my fellowship and I got into regular practice, I found that I wasn't having the impact I really wanted to have. And was I just being too optimistic, or was there really something about the message, about how I was approaching patients, about what I'd been taught for all these years? And it took me a little while, but I started my own sort of boutique wellness center, working with a health coach of mine, who was a friend of mine. And he was very familiar with ketogenic diets and ketogenic lifestyles. And he introduced me to it. And at first I was pretty skeptical, you got to be honest.
So our population, they might know what ketogenic is. So if could you just define some of the simple terms to us? It makes sense, but what's ketogenic?
Yeah. So ketogenic is when you basically restrict carbohydrates in your nutrition to the point where your body is burning fat for fuel rather than glucose for fuel. And it's a very important differentiation because we live now in a society where food is always available and it's usually fairly high carbohydrate food. So our bodies are burning carbohydrates nonstop. Well, we have a second fuel source within us and in the world, which we don't tap into, and that is fat, either our own body fat or the fat that we eat. So if we can restrict carbohydrates enough, our body actually makes this metabolic shift where now we're burning fat. And that's important because if we want to lose body fat, or if we want to reduce our glucose and insulin levels for people who have type 2 diabetes or insulin resistance, this is a very powerful way to do it. But it goes against what most doctors are taught, and certainly goes against what I was taught, especially as a preventive cardiologist. I was taught low fat, low fat, low fat. So once my eyes were open to this, and I saw, one, that the literature actually has a fair number of studies going back to the early 2000s, and I saw that it has such a clinical impact on people, such an impressive impact, that now, instead of thinking people were failing lifestyle therapy or were non-compliant with lifestyle therapy, these terms doctors use so often, now I realize people were enjoying their lifestyle therapy. They were thriving on their lifestyle therapy and seeing tremendous results with weight loss, glucose regulation, insulin resistance, and feeling better. So that really opened my eyes to what was out there. And I started to transition my practice, my general cardiology practice, in that way. But I realized that there were barriers to that as well within the institutions that we work in as cardiologists. So that's when last August I was able to make this transition to working now full-time as the medical director at DietDoctor.com, which is the largest online low-carb resource, where we really focus on providing evidence-based material that is helpful to you to help you adopt a low-carb lifestyle and understand how it will impact your health. And at the same time, I was able to transition my practice into a telemedicine practice, really focusing on preventive cardiology from both the medical and the lifestyle perspective. So that's been my journey, and it's been a wonderful ride, and I'm so happy to be where I am today at DietDoctor to be able to reach so many people to help them with this message.
Wow. In terms of the medical director, so do you keep abreast on the new research that's coming out there? Do you meet people one-on-one? Do you publish things? Do you just verify everyone else's stuff that they're publishing on the website?
Yes, to most of that. So if you go to DietDoctor.com, you'll see we have a news section. And I've been very active in the news section. Anytime a study comes out that has something to do with low fat, low carb, diabetes, metabolic health, if it's pertinent to our readers, I'm going to write something about it. Like, for instance, I just published today an article about the study that said vegetarians have a lower stroke risk. Well, this is interesting because it's getting lots of headlines, and if all you read is the headline, it's going to be convincing that vegetarians have lower stroke risk. But when you examine the data, you see the data doesn't add up. And you can see that we're talking about these nutritional epidemiology studies, which are very poor quality studies. And that's one of my main roles at DietDoctor, is to help people understand the quality of the evidence. And it's one of my main messages. The strength of the recommendation has to match the quality of the evidence. And that's something that there's this major disconnect in our society, which leaves the average person, reading on the internet or social media or a magazine, leaves them very confused, because people can make these grandiose claims about what the science shows, when in reality, the strength of the science doesn't back it up. And this vegetarians having fewer strokes is a perfect example of that. So yes, I'm trying to keep up to date on all the latest news and writing articles about that, and publishing short videos on our YouTube channel to educate people about it as well. And we have a number of longer form guides about, what does it mean to use carbohydrate restriction for type 2 diabetes, or for hypertension, or for insulin resistance. So we have these longer guides that I either write or review to make sure everything is evidence-based and medically reviewed, because really we want to be simple and practical, but we also want to be the most trustworthy site on the internet. And that's, it's a tall order, but hopefully I'm up to the job, and I've really enjoyed it so far.
Yeah, at this day and age, there just seems like there's so much information, so much news, and it's hard for us to know a lot of times what's credible, what's not credible. Like you said, there's a lot of different sites talking about low carb, talking about these types of things. For those that are let's say watching this program, they want to learn more about this, they would go to the DietDoctor.com, and they would kind of look at some of that, right? Some of that information.
So just DietDoctor.com.
DietDoctor.com. Perfect.
DietDoctor.com, and you can find your way through the website. You can also go to our YouTube channel, and there's a lot of material in there to really help guide you. Okay. And we have great courses too, like a Get Started Keto Challenge. If you wanted to say, I want to try keto, what do I do? Well, we have a 2-week keto challenge. We have a 5-week course to get you started. We really want to help you sort of, make this as practical as we can to get you started. Then, we also want to help bridge the conversation with your doctor, because a lot of doctors are going to say, no, that's crazy. You can't eat all that fat. You're going to kill yourself. Well, doctors aren't trained in this. I know. I had that same response when my health coach, who I was working with, said, hey, why don't we try a ketogenic diet on this client of ours? My first response was, are you crazy? I don't want to kill this guy. That was my response. And here I am today, because I realize how just absent the training is, and how backwards the training is. And really, we need to sort of see things from this broader perspective. And not that ketogenic diet or even a low carb diet is right for every single person, but it should be in the toolkit. It should be in the discussion for just about every single person, to see if it's right for them.
Yeah. Can you, just for those that are watching, can you think of a couple of examples, some, you don't have to give their names, but some people that have really found benefits that you've been able to help and change their life with ketogenic or intermittent fasting or things like that?
Oh, sure. And I'm glad you mentioned intermittent fasting, because this concept of intermittent fasting and time-restricted eating is also something that I was never taught and was never discussed. In fact, as a culture, we were, you cannot fast. You have to eat on a regular basis. You have to avoid hunger at all costs. And now we see that's backwards as well, because of the power of regulating when you eat is almost as powerful as regulating what you eat. So the combination of low carb and time restricted eating is a very powerful intervention. And so some examples are, I've seen so many patients who feel like they are on this schedule. You eat breakfast at 7 o'clock, you have your snack at 10 o'clock, you have your lunch at noon, your snack at 2, your dinner at 6, and then another snack at like 8 o'clock, because they're afraid of this feeling of hunger. And it's like hunger is to be avoided at all costs. And their food tend to be low fat, because that's what they've been taught over and over and over again. Well, a couple things. If you're eating low fat, high carb, it can stimulate hunger. It can be not as satiating and not as rewarding to make you feel full. So that's one, you're going to feel like you need to eat more often. But two, if your blood glucose and insulin levels are going up and down throughout the day, that could potentially cause these feelings of either shakiness or hunger, or your body sort of craving and needing more foods. So I've been able to switch them to a low carb diet, the first thing they notice is, wow, I'm not as hungry anymore. I don't feel shaky in the morning. I don't feel like I need my snack anymore. So you can naturally start to space out when they're eating, and all of a sudden they're eating 2 meals a day, or maybe even just 3 meals a day, but they're eating in a shorter window. They start to lose weight, have more energy. A number of people actually promote or report psychological benefits and mental clarity. And that's something that's talked about a lot. There's not a whole lot of evidence behind that, and not everybody gets it, but it's remarkable for the people who do get this sort of mental clarity aspect. And then if you're talking about anybody with type 2 diabetes or insulin resistance, this is the most powerful intervention I have seen in 20 years of practice for controlling blood sugar and getting people off their medications. I mean, type 2 diabetes has traditionally been taught it's a chronic condition. Once you have it, you've got it, and you're not getting rid of it. All we can do is try and manage the glucose level with these medications.
Yeah.
That paradigm is gone. That paradigm is now shifted to this is a completely treatable disease. This is a lifestyle disease that was brought on by lifestyle, and we can treat with lifestyle. We don't need medications to treat it. We might need medications in the short term to keep it safe, keep the blood sugar in a safe range. But with low-carb ketogenic lifestyles, we can get rid of your diabetes so that your blood shows no evidence of it. You're on no medications for it. And this is remarkable. I mean, if you would have told me this 10 years ago, I would have said, you're crazy. That's not possible. I would look at all these teachings that I've been taught. It's not possible. Absolutely possible. And that's what I've seen time and time again. And that's one of the things that's most rewarding, not just from me, but from the other doctors I speak with who were doing the same thing. They said, you know what? I was really getting sort of depressed and dejected in my job as a physician, that I didn't feel like I was really helping people. Now I'm taking them off medications. I'm seeing them smile in my office. I'm seeing their labs all improve. This is remarkable. So we're not only helping patients, we're helping doctors as well sort of revitalize their practice. It's pretty remarkable.
Now, Bret, is it so? You're saying, is this mainstream now? Are all the doctors doing it? Can everyone go in their community and find a doctor and just Google, can I find a low carb or doctor that recommends intermittent fasting?
It's a great question. I wish the
That's
answer
a loaded
was yes.
question.
I so wish the answer was yes. But unfortunately, the answer right now is no. I mean, it's still fighting a little bit of an uphill battle within the medical community because of what the teaching has been and what the practice has been for decades. Now, to try and help people with that, at DietDoctor.com, we do have a Find a Physician site.
Right.
We have a page where you can go on. There's a map, and you can sort of find a doctor near you. We also, and this is very exciting, we have a continuing medical education course. It's a free 3-hour CME course that any doctor, nurse practitioner, PA, or RN can take and get credits for their license. And it's free. And this is part of our mission to try and educate as many people as possible about the benefits of carbohydrate restriction and to be evidence-based about it, right?
Yeah.
You can go on the internet and see that, ketogenic diets do everything from prevent the coronavirus to, making you a superhuman in your mental abilities. Well, okay, that's probably not the case, right? We don't really have evidence to support that, but lots of people get excited about reporting those things.
Yeah.
So the CME is focused on what do we have solid evidence to promote low carb lifestyles to help people in their health. And so it's really aimed at reaching the physician to teach them what are the basics of low carb lifestyles that you can start with your patients now and really see improvements.
Wow. Now, for people that you treat with low carb, how do you incorporate, or do you incorporate intermittent fasting alongside? Can they just do fasting and no low carb? Do they have to do it together? What are your recommendations for those that you help?
Yeah, that's a great question. And in reality, if you can do both, it's fantastic. If you can only do one or the other, it's still a great start. Now, the thing about time-restricted eating or intermittent fasting is it is the easiest thing to do. And that's what I love about it. Something that's easy and effective is sort of the holy grail, because you don't have to think about what you're eating. You don't have to shop for eating. You don't have to spend money. You don't have to count your carbs or worry if it's the right level of intake. You don't eat. You skip breakfast. You skip dinner, however you want to do it. And that in itself is powerful for improving glucose levels, improving insulin levels, reducing your weight, and helping improve other health markers. There are studies that show as little as a 14-hour fasting window, regardless of what you eat, is beneficial for your health. So that's pretty impressive. Now, I think the longer you can extend that, if you can get that to 18 hours or even 20 hours, you're probably going to see more benefit for most people.
Okay.
If you take medications, if you have chronic health conditions, you obviously have to be careful about it. And I can't give any medical advice here.
Okay.
But in general, I think spacing out your eating is very, very important and helpful. Now, if you can combine that with a low carb or a ketogenic lifestyle, I think it makes it even easier, because a low carb or ketogenic diets tend to be more filling. You tend to be able to go longer between your meals naturally, and you're sort of doubling up on the interventions to lower your insulin levels, control your glucose, lower your blood pressure, lose weight. You're doubling up on those interventions. So it works very well together. But if you're someone who's like, I'm never giving up my low-fat diet, okay, just try and space out when you're eating. Don't eat every 2 hours. Don't eat 6 meals a day. See if you can get by with 2 meals a day, or even 3 meals, but condensed in a 10-hour window. If you can do that first step, that's going to probably be beneficial as well.
Yeah. Now, is this something that's only for younger people, or can people in their 70s, 80s? What's the oldest patient that you found that's done well with low carb or time restricted eating?
Yeah, another great question. Anybody can do it. I mean, I've had patients in their 80s doing it and doing well. Now, the problem is, though, as you get older, most people tend to be on more medications or have some other medical condition. So they do have to be careful and do it under guidance. I wouldn't recommend, anybody taking medications or with chronic medical conditions just try it on their own. So it does help to work with someone who has some experience with this, or even if they don't have some experience with it, if you can educate yourself and bring some of that to your physician and say, look, here's what I want to try. I've heard that just spacing out your eating, skipping breakfast can be very beneficial, and I want to try it. Can you help me make sure I'm doing this safely?
Mm-hmm.
Right? Not like it's basically telling them you're going to try it and you want their help. And I think how we talk to our physicians about things is so important.
Yeah.
Not, I'm right, you're wrong, this is what I'm doing. But look, this is what I really want to do, and I want your help. I want you to be on my team with this. Because look, it's hard for a doctor to say no to that, right? They're asking for your help. They're asking for your assistance. That's your job as a doctor. So I think how you start the conversation can be very important as well.
Yeah, yeah. What do you guys see for the Diet Doctor for the future? If we look out 5 or 10 years, what is your goal, your reach with the Diet Doctor website?
Yeah, right now we're the number one low carb website in the world. So people know if they want low carb information, keto information, they want it to be trustworthy and simple to help them with their lives, we're the place to go.
Mm-hmm.
Now, eventually, we might get to the point where anybody who wants to improve their diabetes, well, they're going to know that Diet Doctor has these amazing resources for how to improve their diabetes. Whether they're new to fasting, whether they're new to low carb, we can be that site to help people with their type 2 diabetes. We can be that site to help people lose weight. We can expand our reach. And if you're a physician, a health coach, a nurse practitioner, and you want resources to help your clients, we're that site for people to come to get those resources.
Wow, that's so exciting. It's an exciting time.
It is.
Let's talk about the bigger, so low carb, time restricted feeding. We talked about, yes, it helps weight. Yes, it helps diabetes. For those that haven't really been exposed to it, I don't know if you guys talk about how it helps brain fog, how it affects, some people say about cancer, some people we can just go off and rattle off some of the other benefits than just weight loss. Sure, absolutely. So brain fog's a big one. A lot of people get sort of in this cycle, the 2 o'clock dips in the afternoon where you're tired and kind of fuzzy, or your whole day you just feel like you're in a little bit of a brain fog. Well, getting rid of sugars and refined carbohydrates, replacing it with healthy proteins and fats, for the majority of the people, it's going to help lift that brain fog and really help you think more clearly and have a more level energy level throughout the day, which is so beneficial. You mentioned cancer. I mean, cancer is a fascinating area right now. And I was just at the Metabolic Health Summit where I recorded a couple podcast episodes with cancer researchers. It's on our Diet Doctor podcast. And although the evidence in humans in clinical trials is not there yet, the animal evidence and the anecdotal evidence is very promising for using carbohydrate restriction with or without intermittent fasting as an adjunct to cancer therapy. So not saying all you have to do is go keto and you're going to cure your cancer. Absolutely not.
But if you have cancer and you're being started on cancer therapy, using a ketogenic diet to help mitigate the side effects of the medications and to help with actually some potentially cancer killing properties. It's a very exciting field right now. And then there's this whole area of prevention as well, because we know cancers feed on glucose. We know insulin can be a growth factor for many cancers. And to be honest, we can't talk about cancer like it's one thing, right? There are many different types of cancer. There are many different stages of cancer. So we can't use it as a blanket statement. But things like glioblastomas, brain cancers, some solid tumor type cancers, breast cancer, there's really some hope that a ketogenic diet can be extremely beneficial for that. And intermittent fasting, we actually do have, sounds like some more official protocols using intermittent fasting for radiation therapy, for chemotherapy, to help sensitize the tumor to the effects of either radiation or chemotherapy, and again, help reduce the side effects. Because let's be honest, one of the hardest parts about cancer therapy is the side effects. It can kill the cancer, but it's also going to damage normal cells, and you're going to feel that effect. So anything we can do to limit that really improves the quality of life of the patient. So there's some hope and some evidence that ketogenic diets and intermittent fasting can help with that as well. And we can go down the list. I mean, there are so many other aspects where it can help. Psychiatric disease, mood disorders is another big one. And again, we don't have the clinical trials to show it definitively, but we published a guide on the food-mood connection that talks a lot about using low-carb nutrition to help with depression, anxiety, bipolar disorder. There's even some reports of schizophrenia. I mean, there's mounting anecdotal evidence that it can be very helpful there. So that's something to consider.
Yeah.
Again, if you have that and you're on medications, you have to be careful with it and talk to your doctor about it. Don't just go out and do it on your own. But it's exciting that it's a potential and something that you can discuss. And again, we have these resources on our website. So if you want to print them out, bring them into your doctor, help educate your doctor about it, and start the conversation. I think it's a great way to start.
Yeah, and for those that are watching, is this something, can they do it they go to the website and they can do it on their own? Do they need help? Do you need a health coach? Or can just anyone do it?
Yeah, and that's a good question. I think it's always best to do it with somebody who can guide you. Now, but not everybody may have access to that. So we try and provide enough information in a way to help you understand if it's safe for you or not. And if you have any questions about it, you can always send us questions through the website. But by having a list of doctors, low-carb doctors, and soon we're going to have a list of health coaches as well to connect people with health coaches, we really want to facilitate this for people to make it as easy as possible. But I wish I could just say anybody can go out and do it and it's no problem. No, I mean, there are some things, pregnant women, breastfeeding women, if you're on diabetes or blood pressure medications, if you have severe chronic medical conditions, there are precautions you have to take to make sure you're doing it safely.
Yeah. And I know, not to put you on the spot, but I have to ask you, what do you personally do? Because always the proof is in the pudding. How long have you been doing it? What do you do personally?
Yeah, thank you for asking. So, I think it was probably 2014, somewhere around there, when I was working with Dustin, the health coach, when he first introduced me to low carb. And I said, well, if I'm trying it my clients, I have to try it myself. So I tried it myself first, and I felt those benefits. Like I wasn't really overweight, but I noticed those extra few pounds kind of melted away. My energy level improved, my workouts improved. I felt like I was thinking clear, and I felt better. And I thought, there's something to this. So ever since then, I've basically been following a ketogenic diet. I'll have times where maybe I try cycling and going more low carb, like a 50-gram low carb, which sometimes is still ketogenic for me, and instituting time restricted eating. So I usually will have 2 meals per day within a 4 to 6 hour window, with an occasional 1 meal a day thrown in there. And that's what I try to do for my usual schedule. Every now and then I'll try and throw in a longer fast. And this is not something I recommend everybody do, but I think in general, there's some longevity benefits to a 3 or 5 day fast, but got to be honest, I don't like those. I'm going to be honest about that. I mean, I love the food I eat on a regular basis. I love the time restricted eating. I don't have any problem with it. But the longer day fasts are where I start to struggle a little bit, because I also love to work out. I mean, I'm a bit of an exercise junkie. And if I haven't eaten in a few days and I want to go for a hard mountain bike ride, I know I'm not going to have those gears in my system that I want to have. So So I'm not as big on that personally, I guess. But yeah, time restricted eating and eating low carb, I think are the keys to health that I hold personally very dear. And one of the keys is, I think, adding salt to your water. Just hot water with some salt in it. It makes the time restricted eating so much easier.
Yeah. Now, as we just conclude, you do have a book. It's called Your Best Health Ever, and right. I know is this 100% what the book is about? Is this, or are there a couple of, we can end with a couple of other little tips that you might have for people for better health?
Yeah, good question. So I wrote the book sort of early on in my low carb journey. At least I started writing it early on in my low carb journey, and so it's not purely a keto or low carb book, but it's really about simple tips that you can do for health, whether it's nutrition, sleep, stress, exercise. I try and hit all the main pillars to give you the guidelines and to help sort of deconstruct what the dogmatic message has been, which is not so accurate and not so helpful, and sort of to explain where that message falls and how you can kind of re-educate yourself and what you can implement into your life. But we talk a lot about nutrition. I talk a lot about nutrition, but we can't ignore stress management. Such an important thing, because stress is going to affect the decisions you make during the day. It's going to affect your hormonal levels. It's going to affect your blood pressure. Same with sleep. Sleep is not just something that's people tell you need. It actually affects your ghrelin and your leptin, which are your hunger and your I'm full kind of hormones. It can affect your cortisol levels. It can affect the decisions you make. And we've heard so much that you can't outrun a bad diet, and exercise isn't the best for weight loss. And that's true. Exercise by itself, if you have a poor diet, is not going to get you where you need to be. But exercise and combined with a good, healthy nutrition is such a powerful just life motivator and health promoter that I think that's important too. So yeah, I try to bring those in the book to really help people see the pillars of health that they can hit for a lifetime of good health.
Awesome. This has been great. As we're kind of concluding in the last minute here, so tell people that are watching, and we'll kind of give them we'll put the links underneath this video here. How can they learn more? Where's the website to learn about you, about the Diet Doctor, about the podcast? Let us know.
Yeah. The best place is DietDoctor.com. And you can, if you do DietDoctor.com/podcast, that'll take you right to the podcast, or just go to the homepage and you can go to our news section or our guide section. You can see some of our challenges and our courses you can do. So you can really sort of direct yourself to where you want to go. Me personally, I have a website at lowcarbcardiologist.com. I haven't updated it recently because I've been so busy working with DietDoctor, but that's where I see patients in my telemedicine practice. Although I am limited to where I have a license. I don't have a Massachusetts license yet.
Okay.
Yeah, I think those are the best places to start. And then if you prefer YouTube, you can always go to our Diet Doctor YouTube channel.
Perfect. Well, this has been Dr. Bret Scher. He's the medical director at the Diet Doctor at DietDoctor.com. So Bret, thank you so much for joining us today. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.